People who struggle with heart failure need to take some life-saving steps to stay healthy as possible, which is more important for Black and brown Americans who are at higher risk of developing heart failure at an earlier age. And to explain what heart failure is and what can be done about it is Dr. Hyatt Davuti. He's the co-founder and chief medical officer of Presidium Health Corporation. Good morning.
Good morning, Angie. Thank you for having me on.
Well, thank you for bringing us, I think, what I would call life-saving information about the impacts of heart failure. So let's start with an explanation. What exactly is it, and why does it seem to impact Black and brown Americans more dramatically?
That's a great question, Angie. Heart failure it's a long-lasting and progressive condition that changes the structure or function of the heart and ultimately impedes its ability to do its primary function, pump blood into the rest of the body. It could present itself with a variety of symptoms ranging from a mild cough, some lower extremity swelling, to the other end of the spectrum, shortness of breath, which is ultimately related to increased risk of hospitalizations and is a hallmark of disease progression. Now, it's important to talk about heart failure, particularly in the context of Black Americans, because Black Americans are at higher risk of developing heart failure. They develop heart failure earlier and have worse outcomes with their heart failure than their white counterparts.
Well, those are sobering statements to make. So with that said, what are you encouraged about treatment, about programs that are available?
That's a great question, and they are sobering statements. And while heart failure has seen many advancements in the past decade, significant disparities still exist. And there's things that we can all do. We can lower our salt intake. We can increase our activity. We can take our medications as prescribed. For instance, I'm here with Novartis, and with the primary purpose of raising awareness for disparities, but also talking about heart failure management within the context of ethnic minorities. And a big part of that is prescription medications. Entresto is a prescription medication for long-standing heart failure that reduces the risk of death and reduces the risk of hospitalizations. However, it's not for everybody. The most important thing the listeners should take away is that they should talk to their provider because heart failure is very individualized and thus needs an individualized plan. For instance, with Entresto specifically, it's not for everybody. So the patients that are pregnant, patients that are currently on ACE inhibitors or ARBs, patients who've had prior reaction of swelling called angioedema to ACE inhibitors and ARBs, they shouldn't be on this. And all that is to say that the best thing that your listeners can do is find a doctor and talk to a doctor to come up with the individualized plan for them.
And can you send our viewers to a website where they can learn more?
Absolutely. Entresto.com, it has a lot of great reference material as it relates to heart failure. What is heart failure, how to manage heart failure, what to ask your doctor, things of that sort, in addition to safety information on Entresto.
Dr. Hyatt Davuti, thank you so much for being with us.
Thank you so much for having me.